Now, we want to give you an opportunity to hear from families who are impacted by this, or who work with others who are impacted by this. So, I would like to introduce Cathy Hughes.
Okay, I told myself I wasn't going to be nervous, but I think with my big fan club behind me, I think I got this, right? Good morning, I'm Cathy Hughes. I am proud to serve as the Director of Family Support Services with Family Behavioral Resources and the Autism Education and Research Institute. My bosses are standing right back there. They are supporting this rally. Raise your hands for me. I love you guys. I am most importantly, however, the parent. I am a parent of Christian. Christian is my 14-year-old son who was diagnosed 11 years ago with pervasive developmental disorder. I am honored to be here today to support families and consumers across Pennsylvania. So 11 years ago, I sat at my computer researching anything and everything about autism, and I came across a campaign. Who here 11 years ago filled this rotunda for Drop the Cap, Keep the Ref? Anyone? If so, shout with me. Okay. So we got a lot of veterans here along with our newbies. So it was at that time that I was informed that the services my son had started receiving just a few months earlier were being threatened to be taken away. And that diagnosis came from a court-ordered psych evaluation. Court-ordered. Probably wondering how I got there, huh? That court-ordered psych evaluation stemmed from a community incident where my son engaged in self-injurious behaviors, tantrums, outbursts, and that outburst resulted in misjudgment, and it resulted in my arrest of child abuse, endangering the welfare of a minor, and terroristic threats on my own child, when all I had tried to do was remove him from a situation that was scaring him to death, being in public around too many people. So don't worry, I'm sure none of you expected to hear from an ex-con this morning, but $20,000 later, my name is clear and expunged, so you're all good. So again, this rotunda was filled by families impacted by autism, behavioral health diagnoses, and other unique challenges. And I was in awe of the parents and the grassroots organizations that gave me my first taste of advocacy. And they reminded me that this wasn't just my fight, this was our fight. It's our fight. And I was not alone anymore. And this passion long inspired me past those days. Christian's passionate, devoted team stopped at nothing to ensure his success and brought a minimally verbal little boy with tantruming behaviors and many, many challenges, hi Liz, I love you, into a mainstream classroom with little support. And my son is a poster child for delivering evidence-based treatment with integrity as prescribed. As prescribed. He is living, breathing proof that early intervention works. In treatment, I was unable to work outside the home. Many of you sitting behind me and in the audience know. Appointments, IEP meetings, maybe 5 appointments a day, depending on phone calls and meetings, or come get your kid, because they can't control them in school, daycare, what have you. So, I wanted to give back some of what was given to me, and I was blessed to be given a role at a wraparound agency so I could be the voice on the other end of the line supporting parents and caregivers. Someone that could say, I know you're scared, and I know you want answers. There are services and supports that can help you. Services and supports that can help you. Well, with Gary Alexander's new 11th hour bulletin, as I like to call it, and many of you do too, can I continue to say with confidence that supports and services are readily available for families? Or am I dangling a carrot under their nose as I know that the intensive intervention that my son received to make him successful may not be affordable to the family I'm talking to on the other end? PH95 is our safety net. Families already endure countless out-of-pocket costs that are not being considered by this bulletin. The bulletin does not consider Act 62, as Jim mentioned. It does not consider consumers with a diagnosis of autism, an act that was supposed to help alleviate the state budget, yet 70% of carriers still exclude autism? Yeah, okay. So the DPW struggles with tracking data. Love your letter, Jim. But I bet you wish you were making that much, right? Right? Oh, I do too. So they can't track our income data. They can't send out renewal paperwork on time. How many here have lapsed in service because they didn't get their renewal paperwork on time? Hey, I'm one of them. So they can't manage the data. they can't manage sending us our annual renewal paperwork to ensure that our services stay in place, yet they're ready to carry this out in 6 days? I'm a bit confused. Of most concern to me is that families in desperate need of help will go without the services they need because they just cannot afford to give 5% of their entire income for services. Will they, our MCOs, providers, be able to afford this change? And the answer that many of you will find is no. So let me give you some examples of some of the middle-class families that are going to be hit the hardest. Example one that I spoke to 3 weeks ago. A family with 2 boys with autism have BHRS support in the school setting full-time. They face co-pays of over $600 a month for their children. Her husband struggles with transportation to his 2 jobs to support his family. And if their estimation is correct, they will have to either cut medically necessary services or they'll have to choose between their 2 boys with autism. What parent is willing to make that choice? I would not be. Example 2, and she's right behind me. Dawn is the mother of a young girl with autism and additional behavioral diagnoses who uprooted her family and moved back to Pittsburgh to get services because she couldn't access appropriate care in her county, and she regressed. Her daughter has full-time BHRS support, she has speech and occupational therapies, and her own health problems. With an estimated $500 a month in co-pays, she will have to go against medically necessary services, against her daughter's prescription, and pick and choose what she can realistically afford. Example 3, you're looking at her. My son is a mainstream 9th grade student that in past evaluations has demonstrated very minimal signs of autism, thanks to early intervention. Now, he's back in outpatient treatment due to struggles with transition. And if he regresses much further, I'm going to end up back in the BHRS system. I am a working single mother, I care for my aging sick mother, and I work for a provider, and I would not be able to afford these services for my own son. I don't know what to tell Pennsylvania's families when I speak to them now. I don't know how to tell first-time callers that in a few short weeks, the services that they've been prescribed may be just a pipe dream to them. I don't know how to tell them that the care prescribed to their children so that they may become successful, educated, independent, future tax-paying, and might I add voting, citizens in our state and have meaning sustainable employment when they are adults. It may be unattainable for them. I don't know what to tell families that need family-based mental health services, and I'm looking at one of my workers right there. It's a 24/7, 365 service that provides crucial care for families that are in crisis. Often these families have parents and caregivers involved that have their own mental health struggles or an MR diagnosis and cannot advocate for themselves, cannot advocate for their children, sure as hell can't contribute a copay. They cannot. Families will be torn apart by this outrageous bulletin. So Governor Corbett, Gary Alexander, I personally invite you both to come to my office in Greensburg and spend a day answering my phone. Maybe you can visit my home after hours and answer some of the frantic emails and phone calls and Facebook messages that I am receiving night and day to families who are scared. So I can de-escalate my son after a rough day at school when he is in tears and anxious about going the next day, and also so I can take care of my mother. Don't worry, I'll put the cats away if you're allergic to them. So I am personally not opposed to paying reasonable amounts of money for my son's treatment. Reasonable, and many families will agree with me. However, and I promise you I'm almost done, private insurance companies still exclude coverage for many individuals on the autism spectrum. No finalized structure is in place, and this starts in 6 days. Did I mention it was 6 days? The copay bulletin did not move through our state's regulatory review process. It is being pushed through by an abuse of power that hurts the most vulnerable members of our Commonwealth today. This bulletin is a vicious, unnecessary threat, yet Governor Corbett supports the human services community? We've paid enough. Our children are going to pay the price if you sit back and let Gary Alexander carry out this plan. So do what is right, take accountability for your constituents, and say it with me, no accountability,